showing you the daily routine of opening the dental office. Right this way. The first step is turning on all the lights, as well as the X-ray mount.
So yeah, that's what makes me interested to it.
And then I turn on the dental unit. And these are connected to the central water valve. And then the next step is to turn on the central air compressor and vacuum system. Alright, and the next step was to apply my glasses, and then I wash my hands for 2 consecutive 30-second hand washes. And now I will don my gloves. And the next step would be to make sure that the water reservoirs are full. And fill this one as well as the second one over here. And the next step would be to check the air water syringe. First, you check the airflow for 20 to 30 seconds. And then you check the water flow for 20 to 30 seconds. And then you would check both together for 20 to 30 seconds. And the next step would be to check the oral evacuator for suction strength. You would turn it on, and with a cup filled with water, you would check the suction strength over a sink. And then you would also do the same process for the saliva ejector. You would check the suction strength after you've turned it on in the cup of water. And now we will check the low-speed handpiece by attaching the rotary instrument, and then we would check for rotation and air pressure by pressing on the rheostat. And the next step is to test the high-speed handpiece. And in order to do this, you would attach the rotary instrument, and we will be checking for air pressure and rotation. And we would select air on the rheostat and press. And then we would check for water flow. And to do this, you would switch it to water, hold it over the sink, and check for water flow for a few seconds. And now we will check the operating light by having it directed towards the chair, and then we turn it on, and we test the different strengths. Now we check the reception area. First, we will straighten any magazines that are out of place, and then we will straighten the children's area, fixing any of that, and then we unlock the door for the patients. And now the next step is to go to the business area. We will be turning on the computers, turning on the communication system, checking the answering machine, unlocking all the files, and organizing the business area. And now I'll be showing you where we post patient schedules around the office in designated areas, while also following HIPAA's regulations. Also, it's important to note that you must have patient's information concealed at all times. For example, having a blank sheet of paper covering it, all the information. Also, you can hang this on a wall, or you can have the files in a cabinet. And the next step is to turn on all the equipment in the film processing area and change out the water in the tanks and replenish solutions if necessary. The next step was to remove all PPE, wash hands, and then apply all proper clinical clothing according to OSHA guidelines. Now that we've applied proper clinical clothing, we will now review the patient's schedules and prepare the room for the first patient. To prepare the treatment room for the first patient, we will need to apply all proper barriers, check supplies, and review patient records, as well as preparing appropriate trays and lab work for the first patient. And the next step is to turn on any sterilizing equipment and checking solution levels, as well as preparing new ultrasonic and disinfectant solutions, as well as completing any overnight sterilization procedures. The last step for opening the dental office is to replenish any supplies needed for the day.